Welcome to the Ultimate Depression Survival Kit, How to Overcome and Master Depression with me, Dr. Moses Simuyemba, and today is day 15 and we're looking at secrets to having unbeatable energy. Getting professional help such as therapy and antidepressants helps a lot. It can get you out of that critical slump and restore your mental energy to a good level. It can elevate your mood to normal levels so that you're able then to look at other strategies to combat your depression in the long term. However, to have unbeatable energy, you need something else. To have unbeatable energy, you need balance. That is an important word, balance in your life. And let's look now at what that balance means. Balance means having a well-rounded life. If you look at the World Health Organization definition of health, it is being healthy physically, mentally, and socially. So it has those dimensions of physical, mental, and social well-being as a definition of wealth. Therefore, you must look after your needs in these areas, physically, mentally, and socially. When any one area is neglected, you cannot be totally whole. And now we're going to focus on the two areas in particular that are important when it comes to having unbeatable energy. How do you achieve balance? Well, a lot depends on you. That is why it is important to really know and understand yourself and understand what areas of your life are weaker and lacking, what areas of your life are strong, and where you need to prop up. As I keep saying, no one-size-fits-all formula to this. There is no formula that will work for everybody. It's about tailoring it to your individual needs. But two things are absolutely critical to achieving balance in life, and that is one, physical activity, and secondly, diet. And we are going to delve into that now and look at what the research says around exercise and physical activity as it relates to depression, as well as diet as it relates to depression. Exciting stuff. I hope you're looking forward to it like I am. Physical activity and exercise. So countless research has been conducted on the importance and benefits of exercise in handling depression and other mental illness, such as anxiety. Exercise or physical activity not only has physical benefits, it also has mental benefits. Let me share with you now a few studies on this subject. Here are two studies, so let's focus on the one on the left for now. Daly et al. In 2015 did a systematic review of 6 studies, and the title of their publication was The Effectiveness of Exercise for the Prevention and Treatment of Antenatal Depression, a systematic review with meta-analysis. So they looked at depression in expectant mothers, pregnant women. And they found that a significant reduction in depression scores for exercise interventions relative to comparator groups, meaning that the women who were undergoing exercise as an intervention to see whether it worked for depression had lower depression scores than women who did not go into the exercise program. So that is the comparator group. So you can see here that they found an effect of exercise on reducing depressive symptoms in these pregnant women. Stanton and Rearburn on the right there in 2014 also did a systematic review of 5 other studies titled Exercise and the Treatment of Depression, a review of exercise program variables. And they found that both group and individual programs, that is exercise programs, were shown to be effective in lowering the symptoms of depression. So 2 studies here that reviewed other studies and came to the conclusion that exercise was effective in reducing symptoms of depression in different groups. 2 more systematic reviews here. On the left by Mura et al. Published in 2013, they reviewed 13 other studies on exercise and depression. Their publication was titled Exercise as an Add-on Strategy for the Treatment of Major Depressive Disorder, a systematic review. And they concluded from these 13 studies that studies showed a strong effectiveness of exercise combined with antidepressants. So here is one that shows that medication and exercise go well together in combating depression. On the right, Josephson et al. In 2014 also did a systematic review of 13 other studies. They titled their publication Physical Exercise Intervention in Depressive Disorders, Meta-Analysis and Systematic Review. And they found that there was a significantly large overall effect favoring exercise intervention in depression. Exercise may be recommended for people with mild and moderate depression who are willing, motivated, and physically healthy enough to engage in such a program. So here it is. They found that exercise had actually a large effect in reducing depressive symptoms. And I like what they said at the end there, that in people who are willing, motivated, and physically healthy enough to engage in such a program. Because bear in mind that not everybody who has depression may be suitable for an exercise program. You might have a chronic illness that prevents you from engaging fully in exercise. You might have a physical disability that disables you from engaging fully in exercise programs. So always important to bear that in mind when recommending exercise to anybody. Two more systematic reviews here. The evidence keeps growing on exercise and depression. Duan et al. In 2016 did a systematic review of 29 other studies, and they found that exercise is a robust add-on treatment for improving clinical symptoms, quality of life, global functioning, and depressive symptoms in patients with schizophrenia. So their study was titled Exercise Improves Clinical Symptoms, Quality of Life, Global Functioning, and Depression in Schizophrenia. So here a specific target group who had another mental health condition, that's schizophrenia, but with depressive symptoms, and they tried to see how exercise affects depressive symptoms in this group. And they found it was a very effective add-on strategy, meaning combined with other strategies, it proved very effective in this group. Bailey et al. In 2016 also did a systematic review of 16 other studies titled Treating Depression with Physical Activity in Adolescents this time and Young Adults, a systematic review and meta-analysis of randomized controlled trials. This one found that there was a large effect of physical activity on reducing depression symptoms compared to controls. Remember, controls are those groups that were used as a comparison who did not go through exercise as an intervention in order to compare to the group that went through exercise as an intervention. So they found that those who went through exercise as an intervention had a reduction in depression symptoms compared to those who did not. So this shows that the intervention, which was exercise, was effective in reducing depression symptoms. And so you can see different studies here on exercise in the elderly, in adolescents, in people with other mental health conditions, in pregnant women, all showing that exercise has an effect on improving or reducing depression symptoms. Very powerful stuff and very exciting stuff for me to know that exercise can have such an effect on so many different groups in such a big way. And finally, the last study we'll look at by Reiner and Watts, published in 2016. They did a systematic review of 41 studies, and their publication was titled Exercise and Depressive Symptoms in Older Adults, a systematic meta-analysis review. They found that exercise was associated with significantly lower depression severity, and the effect was not significantly different for different ages of participants, types of control groups, or type of exercise interventions. Therefore, exercise is an effective treatment option for older individuals with depressive symptoms. So very interesting findings again. They found that exercise, no matter what kind, no matter what the age group of the participants, was effective with lowering the severity of depression. So very exciting findings there in this study too. Exercise has been found to have a lot of benefits, not just mentally, but also just generally and physically. In terms of mental health benefits, this is just a summary. It's a long list, but you get the idea. It improves sleep, improves self-esteem and confidence, reduces stress levels, improves memory, improves mood, reduces anxiety, increases energy levels, increases pain tolerance, helps with self-discipline, improves concentration, and has social life benefits. So it combats depression through all these mechanisms. Really a powerful tool for you to use in terms of mental health and add to your arsenal of how to combat depression. Other than that, it has general benefits, of course. Physically, we know it improves mobility, weight management, reduces diabetes and hypertension risk, strengthens bones, improves coordination, boosts immunity, reduces cancer risk, strengthens muscles, detoxifies the body, and improves appetite. The list is long, folks, and this is by no means exhaustive. The take-home message here for you is you need to include exercise in one form or another into your routine. You need to include it as a way of combating depression, overcoming depression, because its benefits are just immense. You know, since I started gymming, I find even when I have a bad day at work or I feel a bit anxious, you know, the general things we go through, once I get to the gym and put in an hour's workout, I feel perfect. You know, my mood improves. I feel more energetic. I feel like I can take on anything, even no matter how tired I was before I got to the gym. So you have no reason, absolutely, to not want to include exercise in your program, in your ways of combating depression. It is a powerful tool. And if you are not utilizing it, then you are missing out on a lot. That is me there, showing the difference exercise has made to me, you know, from in a period of 2 years, from 2017 to 2018. I started gymming regularly 4 or 5 times a week, sometimes 6, depending on the program I was doing. And the physical transformation is very apparent there. I've continued, and even a bigger transformation now as I speak. I usually make updates in December, so I can't wait for this December to put an update on my progress. But you can see there a change in me, both in my physical look, my mental attitude. You know, I look more confident and so on. And this is what exercise can do for you if you stick to it and are consistent with it. So watch my video on my fitness journey where I describe some of the things and give you some tips about exercise and what to do and what to avoid and so on, so that you get the most out of it. But it is an exciting journey, and a lot of people who have gone through exercise for different things, you know, whether it's for managing hypertension, diabetes, or depression or anything else, will tell you that it has benefits way beyond what they intended it initially for. They just find that generally their whole life improves. You know, they feel more energetic, they work better, they are more focused, and so on and so forth. So exercise is a great way to beat depression. It's a great way to have more energy. We have looked at exercise and its role in depression, as well as in giving you unbeatable energy. Let's now focus on diet and its role in depression and how it will help you to have unbeatable energy. So diet has a significant role to play in our physical and mental well-being, as you know. Diet is all about meeting energy needs, meeting nutrient needs, weight control, and pleasure. Now, let's focus now on why diet is such an important thing when it comes to depression. Let's get into the studies on diet and depression, starting with this one by Molendic et al., published in 2018, so a very recent article. It was a systematic review of 24 different studies titled Diet Quality and Depression Risk, a systematic review and dose-response meta-analysis of prospective studies. Now, this study found that adherence to high-quality diet, regardless of the type, so as long as it was healthy or a prudent diet, was associated with a low risk of depressive symptoms over time. So good quality diet generally associated with low risk of depressive symptoms. And they also found that a relatively low dietary inflammatory index was also associated with a somewhat lower incidence of depressive symptoms. So I won't get into much about dietary inflammatory index, but what that is basically, this is a measure of how much inflammation foods cause in the body, because inflammation, you know, has been found to be a cause of many ailments, many chronic illnesses, immune conditions, and so on. And also, it has been found to play a role even in depression. So they found that foods with a low dietary inflammatory index were associated with a lower incidence of depressive symptoms than foods with a high dietary inflammatory index. Similar associations were found for the consumption of fish and vegetables, but not for high-quality food groups. So they found in this study that fish and vegetables decreased depressive symptoms or risk of depression, and therefore fish and vegetables were protective when it came to depression. So quite interesting findings in this study, but let's look at some more studies on the subject. Another systematic review here by Khalid et al., published in 2016, and they reviewed 20 different studies. Their question or article was titled, "Is there an association between diet and depression in children and adolescents?" And they found that overall, there was support for an association between healthy dietary patterns or consumption of a high-quality diet and lower levels of depression or better mental health. Secondly, similarly, there was a relationship between unhealthy diet and consumption of low-quality diet and depression or poor mental health. So you see that diet here was found to have a critical role in these 20 studies. A poor diet led to more depressive symptoms, whereas healthy diet led to lower symptoms of depression in this group of adolescents and children that were studied in these 20 different studies. Another study by Sparling et al., published in 2017, a review of 35 different studies, titled "The Role of Diet and Nutritional Supplementation in Perinatal Depression." So they studied depression around the childbearing period in women. And they found that four main categories, or rather, they analyzed four main categories of dietary intake. One factor was adherence to dietary patterns, a full panel of essential nutrients, meaning essential nutrients that the woman received. And they also studied specific nutrients such as vitamin B, vitamin D, and zinc, and intake of fish or polyunsaturated fatty acids, also abbreviated as PUFA. So these different studies that they looked at focused on these different areas. And 13 studies, including 3 about PUFA supplementation trials, found no evidence of an association. So here, no evidence of an association in here, but we'll find other studies that also found evidence of an association. 22 studies showed protective effects from healthy dietary patterns, multivitamin supplementation, fish and PUFA intake, calcium, vitamin D, zinc, and possibly selenium. So you can see that although some studies did not show any evidence, 22 studies showed that there was evidence of protection against depressive symptoms from taking multivitamins, fish, and polyunsaturated fatty acids, calcium, vitamin D, zinc, and selenium. So overall, one would argue then that the evidence for diet having a role is stronger than the evidence against diet not having a role, as was shown by those 13 studies. But we'll find other studies that also support the view that diet does have a great role to play in terms of depressive symptoms. Sanhuze et al. In 2013 did a systematic review of 11 studies titled "Diet and the Risk of Unipolar Depression in Adults," systematic review of cohort studies. They found variables inversely associated with depression risk, and these are listed below. So when it says variables inversely associated, it means that taking these substances was associated with lower depressive symptoms or lower risk of depression. So the consumption of nutrients such as folate, omega-3 fatty acids, which are also, regarded as polyunsaturated fatty acids or fish oils, in other words, monounsaturated fatty acids, foods such as olive oil and fish, and a diet rich in fruits, vegetables, nuts, and legumes. Some of these associations varied by sex, and some showed a non-linear association. Diets rich in fruits, vegetables, nuts, and legumes were protective against depression. So you can see that these 11 studies looked at a number of variables, a number of factors to do with diet, and these are the ones they found to be protective against depression. So if you take these, according to these studies, your risk of having depressive symptoms was lowered. Jerome et al., 2013, a systematic review of 2 studies on magnesium and depression, and they found that a higher intake of dietary magnesium seems to be associated with lower depression symptoms. Magnesium seems to be effective in the treatment of depression, but data they pointed out are scarce and incongruous. Of course, you can see that it was only 2 studies here. Disturbance in magnesium metabolism might be related to depression, and oral magnesium supplementation may prevent depression and might be used as an adjunctive therapy, meaning it can be used as an additional therapy when combined with other therapies such as antidepressants or psychotherapy, whatever else it might be. So promising studies on magnesium here that show that there is a link between magnesium and depression, and magnesium is protective against having depression. Another study by Saris et al. Published in 2016. It was a systematic review of 38 different studies titled Adjunctive Nutraceuticals for Depression. So they studied various substances and how much they affected depression. And these are the substances they found, they looked at. There was a primarily positive results were found for replicated studies testing S-adenosyl methionine, methylfolate, omega-3, which we've discussed already, and vitamin D. So these substances were protective against depression according to this study. And with positive isolated studies for creatine, folic acid, and an amino acid combination. So showing that these combinations of nutrients are protective against depression. Now, don't worry too much about the names and scientific names of these. I will tell you in a moment as we go through this presentation what foods you can take that are rich in these type of nutrients. So don't worry about that. This is just important to know that there is a link between what you eat and your depressive symptoms. In this same study, mixed results were found for zinc, folic acid, vitamin C, and tryptophan. So meaning that some studies showed protection, others did not. And they found non-significant results for inositol. No major adverse effects were noted in the studies, so taking these substances did not result in any adverse effects, though in some cases it did not show strong evidence of benefit either. A meta-analysis of adjunctive omega-3 versus placebo revealed a significant and moderate to strong effect in favor of omega-3. This is very important because it shows that what omega-3 fatty acids, which are commonly found in fish and fish oils, are very protective against having depression or decreasing depressive symptoms. Conversely, a meta-analysis of folic acid revealed a non-significant difference from placebo. So not very encouraging results on folic acid there, but you can see the results. And by the way, I'm presenting the results to you as they found them. So some positive and some negative. There is variation in different studies in terms of what they find, but what one has to do is get an overall sense of things. So generally, you will find that there are more studies in support of folic acid being protective against depression than there are otherwise. And so it is important to bear that in mind as you listen to this presentation. Grosso et al. Did a systematic review of 21 studies in 2016, and they studied dietary N3-PUFA. Don't worry about complicated names. That is the same as omega-3 fatty acids or polyunsaturated fatty acids. And it was dietary N3-PUFA, fish consumption, and depression. And they found a relation between fish consumption and depression, resulting in significantly reduced risk of depressive symptoms for those that took fish, okay? And it was a linear dose response, meaning it responded to dose. The more fish you took, so the more of these fatty acids you took, the less depressive symptoms you had. And this supports the hypothesis that dietary N3-PUFA intake is associated with lower risk of depression. Pooled risk estimates of depression for extreme categories of both total N3-PUFA and fish-derived N3-PUFA resulted in decreased risk for highest compared with the lowest intake. So again, complicated language there, but all it's saying is that the more of it you took, the less likely you will have depressive symptoms, or the less severe depressive symptoms would be. And dose analysis revealed a J-shaped association with a peak decreased risk for 1.8 grams per day intake of N3-PUFA. So they even showed what is the optimum dosage of these omega-3 fatty acids or polyunsaturated fatty acids you need to take in order for you to have the optimum protection from depressive symptoms. Quite a thorough study there, quite a thorough review of different studies, and very exciting evidence on the benefits of omega-3 fatty acids, consumption of fish, and so on. Sagafian et al. In 2018 did a systematic review of 27 studies titled Fruit and Vegetable Consumption and Risk of Depression, Accumulative Evidence from an Updated Systematic Review and Meta-Analysis of Epidemiological Data, long title. But the studies provided further evidence that fruit and vegetable intake was protectively associated with depression. In other words, taking fruit and vegetables decreased your risk of depression as well as symptoms of depression. These findings support the current recommendation of increasing fruit and vegetable intake for improved mental health. With regard to vegetable consumption, every 100-gram increase in intake was associated with a 3% reduced risk of depression in cohort studies and 5% reduced odds in cross-sectional studies. So the message here is that the more vegetables you consume, rather, the more protection you have against depression. Isn't this exciting evidence? I mean, that fruit and vegetable can protect you from depression. What could be easier than eating more fruit and more vegetables in order to be depression-free, folks? This is just exciting stuff for me. They went on to say that consumption of vegetables was also associated with a 14% lower risk of depression in cohort studies and 25% lower risk of depression in cross-section studies. An inverse significant association was observed between intake of total fruit and vegetables and risk of depression in cross-sectional studies. So all it's saying that all the different studies, cohort, cross-sectional studies, and so on, all found a protective measure of fruit and vegetables against depression. Very good stuff here. So another factor to do with depression is the glycemic index, is a ranking of carbohydrates in foods according to how they affect blood glucose levels. So carbohydrates with a low glycemic index of 55 or less are more slowly digested, and therefore they release sugar into your bloodstream at a slower rate, whereas carbohydrates with a high glycemic index are absorbed quickly and release sugar into your bloodstream at a faster rate. Generally, you'll find that very processed foods have a high glycemic index. White foods such as white rice, white meal, very processed foods have a high glycemic index. They are absorbed very quickly. White bread, white pasta. Brown things generally, which are less processed, brown rice, brown bread, such things tend to have a lower glycemic index. And so generally it is thought that eating things with a lower glycemic index is protective. So a lot of studies show that a diet with low glycemic index results in lower risk of depression. So controlling your sugar levels in terms of your diet, how quickly your sugar levels rise in your blood, has been found to have a role as well in protecting against depression. Here is one study by Safari, Mogadan et al., published in 2019. It is a systematic review of 8 other studies titled Glycemic Index, Glycemic Load, and Depression, a systematic review and meta-analysis. They found a significantly positive association was observed between dietary glycemic index and depression in cohort studies. So in other words, low glycemic index foods were associated with protection from depressive symptoms. Rahimlu et al. In 2018 also did a systematic review of 6 studies titled Association Between Dietary Glycemic Index and Glycemic Load with Depression. And they found that a diet with lower dietary glycemic index may be effective to reduce the risk of depression. Now, another exciting thing, how simple can it be to switch from eating white rice to brown rice, from eating white bread to brown bread, if that is going to protect you against depressive symptoms? These are simple things you can do in your life, in your diet, in order to be depression-free. I covered body mass index when we talked about understanding yourself on day 3. And so this is just a recap on that if you want to find out how healthy you are, whether you're underweight, overweight, or correct weight, as far as managing your weight, as far as diet is concerned, you can use this to do so. And I did talk about in day 3 in more detail about how you make these calculations and what the formula is and what to look out for in terms of yourself personally. So if you need to go back to that, go back to day 3. You can also find more research on obesity and depression on day 3. So I won't go into too much detail here, just to remind you about that. So in summary, by the way, if you need to read more about all these articles that I've presented to you today on exercise, on diet, follow the links at the bottom of the page. You will find the relevant articles for you to read more. You'll find the summary of the articles in the PDF document too. Feel free to read those and get more information. I was going very quickly here because I just want you to get a sense of things and a sense of what matters and what does not matter as far as diet goes, but also just to appreciate that diet and exercise affect your risk of depression as well as the severity of your depressive symptoms, and that these are very tangible things you can do and change in your life to improve your depression. So in summary, dietary factors that help with depression are: one, having a balanced diet, and we'll look at that, but a balanced diet in terms of the right intake of proteins, the right intake of carbohydrates, the right intake of fruit and vegetables is very important in terms of balancing your diet. Omega-3 fatty acids or polyunsaturated fatty acids have been found to be protective of depression, and fish oil related products are extremely rich in omega-3 fatty acids. Other micronutrients that have been found to be protective against depression include zinc, include folic acid, also called methylfolate sometimes, include vitamin C, vitamin D, and magnesium. There's also S-adenosylmethionine, which is also protective against depression. Olive oil has been found to be protective against depression. And diets rich in fruits, vegetables, nuts, and legumes. And lastly, avoiding refined foods and fast sugars. So foods with high glycemic index. Aim for foods with a glycemic index of 55 or less. So that might be hard to tell, of course. The bottom line is go for foods that are as unprocessed as possible, brown things rather than white things. Avoiding fast sugars like energy drinks, like refined fruit juices, especially sodas. Those are very high in glycemic index, so you need to avoid that. So this is general guidance on diet and what you can do with your diet to improve your depression symptoms. Now, I find this so exciting because these are relatively simple things that you can change about your lifestyle that can help you to overcome depression. Now, I realize that it can be very difficult to get the right balance of all those nutrients and to know what foods to take in order to meet all your nutritional needs. So I would say go for a balanced diet. Make sure you eat enough protein, carbohydrates, fruits, vegetables, nuts in your diet. Include some of those other things like olive oil and so on and so forth. But it can be very hard to get the other things like magnesium, zinc, iron, folate, and to know how much of it you're getting in your diet. So from that perspective, supplementation becomes very important. And here is a screenshot of a picture of my supplements that I take every day. So I take Probiflora, which is a probiotic. We will cover probiotics on the last day. Very exciting stuff, and research around probiotics. We'll cover that on day 30. Omega-3 fatty acids, which we've discussed, fish oils or polyunsaturated fatty acids. You can get those supplements, very nice little capsules that you can just drink with your breakfast or any meal. And the dosage is there. So I take that daily. And there is the multivitamins, of course. So you have to check that it's a multivitamin that includes all the essential vitamins that are protective against depression, such as magnesium, folate, vitamin D, calcium, vitamin C, and so on. And this package, this one that I take, has all those micronutrients plus a lot more. So this is one way to cater for your diet, but I must caution that supplements will never replace a healthy diet. You can take supplements, but you need to also take a healthy diet, a balanced diet. The two work well together. You can never have supplements totally taking the place of a good diet. Now, apart from taking the right mix of nutrients and making sure you have a balanced diet, it is very, very important also that you watch your portion sizes, especially when it comes to issues of maintaining your weight. As we've seen, that obesity plays a big role in depression. On previous days of this video series, you need to also watch how much food you're taking so that you don't become underweight or overweight or obese. A simple thing to do is follow the rule of thirds. So the rule of thirds, for instance, says a third of your plate should be carbohydrates, a third should be fruit or vegetable, and a third should be protein. This is particularly relevant for people like me who are into gymming and therefore bodybuilding and need a high amount of protein for that. There is another possible rule which applies more to the general public, is 50% fruit and vegetable, 25% carbohydrates, and 25% protein. So you can see that plate how it's outlined. 50% fruit veg, 25% fiber-rich carbohydrates or carbohydrates with a low glycemic index, and 25% protein-rich foods. So if you get that balance right, then you will have a balanced diet. I think a lot of us make the mistake of eating far too much carbs, which adds up to our weight gain, and not enough fruit and vegetables. So those are areas generally that a lot of people need to improve on. So you can follow that rule of thirds, or the rule of, or another possible rule of 50%, 25 and 25%. You must absolutely avoid sodas and drinks high in sugar, even some fruit juices. I won't mention some brands here, but you know, for a long time I used to take fruit juice and think any fruit juice is healthy, until I read the nutrient information on some of these fruit juices, and I found that actually some fruit juices have even higher sugar content, added sugar, than the sodas, you know. So very dangerous situation. And so I had to learn to avoid some of these fruit juices as well, and go for fruit juices with no added sugar and just watch the sugar content. But absolutely avoid sodas. You know, they are packed with sugars. They have high glycemic index. They contribute to a lot of things. Some studies have shown, such as even skin ailments, immune system disorders, and even can contribute to depression and so on, because of that high sugar load and other things they contain that are not healthy. Follow the rule of the fist. This is a very simple rule I learned as I went through my gymming and bodybuilding journey. It's the rule of the fist. So it says that basically your carbohydrate portion size at each meal should not be more than the size of your fist. So if you can make a fist, you need to see that whenever you're eating a meal, your carbohydrates are not more than that. So your pastas, your rice, your nshima, your potatoes should never exceed the size of your fist at any one meal. Very simple rules. So if you follow these rules, you know, the rule of thirds, or the other rule of 50%, 25 and 25, and the rule of the fist, you should be fine. All I'm saying here is that watching your diet does not have to be complicated. You do not have to measure everything. You do not have to look at every package and see how much contains of this or of that. If you follow these simple rules, your life will be very simple. You'll be able to get the right mix of nutrients, be able to have a balanced diet without too much hassle, and it will be easy for you to stick to this because it is not hard to remember and not hard to follow. Finally, as we conclude on diet, these are the things to avoid. Avoid diets and fads. What do I mean by diets? I mean that you want to lose weight and therefore you go on some diet for 2 weeks, 3 weeks, or a month to help you lose that weight. The reason that is not sustainable is that starvation diets do not work in the long run. All they do is make your body think you are living in a time of hunger, a time of not having enough food. So your body's hormones go into reserve mode. They go into reserving food and energy stores, storing fat. So while you might lose fat during the period you're on that diet, you will find that when you get off that diet, your fat returns very quickly because your body's hormones have gone into that state of thinking, hey, we don't have enough food. So when this person eats any food now, let's store some as fat. Let's store this energy because they are starving in this environment, and therefore we need to beef up on our energy reserves. Very dangerous. Avoid fads. Make eating right a habit and a lifestyle choice. If you eat right every day, if you exercise properly, there will be no need for you to go on these diets and these fads and starve yourself for 3 weeks, 4 weeks, eat only lettuce for that period of time, or drink only water for days on end. That can be even more detrimental because it deprives you of nutrients your body needs to function properly, and can even make it worse for you in terms of depression. Avoid diets that emphasize only one thing. For example, fruit only, water only, vegetables only, and so on. Your body needs balance in its nutrients. You need to balance your body, your body's energy and nutrient needs. Avoid binge eating. For example, starving all day and having only one meal at night. Some people think that is effective because they are, not getting too much nutrients into their body, and therefore they will lose weight if they binge and eat. So avoiding meals and just having one meal a day, that is very dangerous because, again, like I said, it takes your body's hormones into conservation mode, where whatever you eat now, The body thinks, let me store some of this because next time this person is not going to have enough food for the next 24 hours, so I need to store some for that period. Avoid such things. Another important thing is never miss breakfast. It is breakfast for a reason. You are breaking your fast from the whole night. Breakfast is the most important meal of your day. Have a good breakfast. It puts your body into the right hormonal balance in terms of food intake, gets your body out of that starvation mode, and sets you up for a very productive day. So if there's one thing I would say, never miss breakfast. I used to miss breakfast for a very long time, and it was very detrimental to me. I noticed a big change when I decided to never miss breakfast and always have my breakfast. It makes my day more productive. I feel better during most of the day, and I tend to eat less the rest of the day when I have a good breakfast. So never miss your breakfast. Balance and frugality are key. Eat the right mix of things and eat them in the right quantities. So if you get these things right, you can find that you can eat 5 to 6 meals a day and not put on weight if you practice these things properly. In my fitness journey, most days I eat 5 to 6 meals a day. You know, there's breakfast, there's a snack, mid-morning snack, then there's lunch, then there's an afternoon snack, then there's dinner, then there's another snack after dinner. Now, you might say that's a lot. I'll put on weight, but I'm not putting on weight. I'm seeing my body grow muscularly in other areas, but I'm not seeing it grow in terms of fat. And a good measure of checking your fat as an adult, a simple way, let me give you a tip, is your waistline. So if your waistline is growing, you need to do something about your diet. But if your waistline is not growing, then you are on track. And I know that because the rest of my body is growing. I'm getting muscular, more muscular physique, but my waistline is not growing. So therefore, I know that even if I'm eating all these meals a day, it is the right mix of nutrition. It is going to the right places, and it is not adding to putting on weight. So it might seem complicated here, but I promise you, if you practice these simple rules, your life will be much easier, and your dieting and your weight goals will be met without problems. It's a matter of making it a lifestyle rather than fads and following diets. So there you have it, secrets to having unbeatable energy. And here we emphasize diet and exercise or physical activity as the two big secrets to having unbeatable energy. I love that there's evidence from a science perspective, from research, dozens and dozens of articles showing that diet and exercise have protective measures against, or protective effects rather, against depression, and that if you practice exercise, your risk of depression and your symptoms of depression are likely to decrease, and also certain dietary measures that can decrease your risk of depression and your symptoms of depression. I like these because there are simple things that you can do in your life to change how your depression is going and your lifestyle generally, and also just generally have more energy, have more focus, have more drive. And you need to benefit from all these things that are good about good diet and exercise. I hope you will add this to your arsenal when it comes to addressing depression. Remember, this is the ultimate depression survival kit, and we are here to give you multiple ways to handle your depression. This is a big one, folks. Diet and exercise. Look into this one seriously. If you are not already doing some form of exercise, I would urge you to find some exercise that is suitable for you, your age, your physical condition, and so on, and where you live. And I would urge you to watch your diet very strictly and follow the simple measures about diet. You will notice immense change in your depression once you practice these things. So go through the exercises to learn more about diet and how it affects you, and to apply this learning to yourself. Have a good day, folks. All the best. Pleasure having you here.